This is Jerry Hesch at the Hesch Institute in Henderson, Nevada, and this is our case of severe disc degeneration of L5-S1 with probable pelvic joint instability. This is part 2, and this is again, the Hesch Institute in Henderson, Nevada. We do consultation and treatment for complex injuries throughout the body, joints throughout the body, not just the pubic joint and sacroiliac joint, but head to toe. And we also have seminars that we teach other clinicians to treat. And we also have a distance learning program. And our website is heschinstitute.com. It's spelled H-E-S like Sam, C-H. And I'm going to focus on Deborah now. You can see that she's carrying a cane and she's carrying 2 supports. In her hand she has a lumbosacral support and a pubic joint support. And you can see that she's walking, carrying those now. So why don't you go put those on the chair. Today we decided, rather than applying the supports, we decided to treat her sacroiliac joints. Go ahead and turn around and walk back. And yesterday you were not able to walk like this unless you had the braces on.
That's right.
Today you're walking without the braces.
That's right.
What are your thoughts?
Well, I guess that I'm excited that just a simple procedure, what you did to my body, was able to align my pelvis in such a way that I can walk without.
And I so hate the word
aids.
alignment.
I know.
Rather than
I'm
alignment,
sorry.
no, we did. No, I did not align your pelvis.
No.
Your pelvis did not get aligned.
No. Okay.
What I did to your pelvis, to the best of my understanding, is I used fulcrums, and I used one on each side for a total of 10 minutes. Mm-hmm. Okay? And I restored normative movement in the transverse plane through the iliac bones on each side. I restored movement there.
Movement.
Where movement is lost, you can have a hypermobility in the opposite direction. So it is my belief that I reduced the hypermobility by increasing movement in the opposite direction. Alignment, your pelvis was aligned when you were on the table and you couldn't walk. Mm-hmm. So alignment is not your issue. You never had an alignment issue.
I guess that's what I've been told for 17 years.
I know. That's. I just so dislike that word.
Yeah.
But Brian, can you comment? Her husband, who's a police officer, you're in your profession. You are paid to make observations.
Yeah.
Right. You have an acute sense of being able to look at something and extract information. Right.
Yes. Yeah.
Okay. Your comment on how she's doing, please.
Well, in the last 6 to 8 months, this is the best I've seen her be able to walk and move around without the ability of a cane or holding on to railings.
Or onto somebody else.
Or kind of limping or help from somebody else to get around. So just the limited amount of time that we've been here, it's been evidence that something has changed to enable her to be able to walk like she has been.
Yeah, and we're 4 hours into it because this is your second visit. This is the end of 2 2-hour visits. So it does take time to get this, it took time for me to put it all together.
Yes.
I'm pleased with what we found today. I wasn't aware yesterday that there was something that was treatable. Yesterday, my absolute belief was the joint's too sloppy. You're going to have to use these 2 different supports. I still think you need to. I don't know the answer though. But I still want you to use those supports and see if they will help you gain more stability in the joint. And I know a lot of people have a negative belief about supports. Oh, you're going to get weak. We showed yesterday you are stronger when you wear those supports.
Absolutely, I am stronger.
Therefore, you'd be more functional. You'd have less pain. Therefore, you'd be more functional. Therefore, you would be strengthening more. And when you go to rehab, when you go to PT, you would be able to tolerate more strengthening.
Right.
So I still, even though you're walking really well today, my belief is still that you need to use these supports for a period of time. What are your thoughts?
I'm definitely going to use the supports for a period of time. Yeah, absolutely.
If we learn otherwise,
then I won't.
Yeah.
But I do know that based on what I've learned and what you've discovered about my body, I will not have any surgery done.
Right.
None.
Yeah, they were kind of pushing that, weren't they?
Yeah, that is definitely the leaning.
Yeah. Where did you go to Where were they? Were they suggesting surgery in Canada?
No, it would have been, I went to Gainesville, Georgia.
I see. You saw a PT and an orthopedic surgeon?
Yes, I did.
And he pretty much just does SI fusions? Is that?
No,
He does other things?
He does other things as well.
Okay.
Yeah, but he's done several SI fusions, and he wasn't very confident that I could heal conservatively.
So he, in spite of the lumbosacral degeneration, the severe degeneration of that disc, the focus was more on the SI?
Correct. Even though I tested negative with the
Yeah.
provocative testing, but I
Right.
tested positive with the pubis symphysis joint.
I see.
Yeah. Yeah, and that didn't make sense to me.
Yeah. Anyway, after I did this treatment, I still did some stress tests to your joint. We
Yeah.
still provoked pain on the table.
Yes.
And it's because we provoked pain on the table that makes me think that we still need to use those supports for a
Right,
period of
yeah.
time. But this is just your second visit. We'll have a third visit tomorrow, and we'll continue to look. And you're going to have an opportunity to go try another support and see if it'll encompass both
Right.
the lumbosacral junction
Yes.
and the pubic joint, worn over the trochanters to compress that joint.
Right.
So we'll learn more tomorrow. This is part 2, and once again, if you would walk one more time, this was
Sure.
not, I didn't expect this today. I had no expectation that you would be able to walk like this without those 2 supports on. So this is very encouraging. It really ups the optimism.
Yes, absolutely.
Yeah.
Yeah.
All right. Thank you very much.
You're welcome.